Welcome to the Pharmacy Briefing series. Twice a month, I will break down the most important pharmacy news and updates, mostly UK based, and translate them into what this actually means in practice. No headlines for the sake of it, no hype, just changes that affect workload, clinical responsibility, patient care, and the future of our profession. If you work in pharmacy and want clear, grounded updates, then this is for you. So in this episode, I'm covering 4 developments that show exactly how the UK pharmacy landscape is right now. We'll look at the latest NHS funding decisions and what they realistically change on the ground. We'll look at how many millions of patient consultations that are quietly shifting into the community pharmacy space, and why palliative care standards are back into focus and where variation becomes a risk. And finally, we'll look at the workforce numbers that sit underneath all these developments and why they matter more than ever. In short, UK pharmacy professionals are doing more than they ever have, with more funding, with more patients, with more clinical responsibility. But here is the uncomfortable truth. The system is expanding faster than the workforce recruitment holding it together, and the tensions are starting to show. So why this matters now? If you work in UK pharmacy, then this video will not be news to you. It's your daily reality. In the last year alone, we've seen significant funding differences, millions of patient consultations being shifted into community pharmacies, wider clinical expectation, and a growing concern on the workforce's sustainability. And today I wanted to break down what's changed, what's working, and where the cracks are forming, without spin and without doom. So funding is necessary, not transformative. The government has committed 600 million in additional support for community pharmacies alongside debt relief. This matters. It keeps services alive and it stabilizes a fragile system. But funding alone does not design the workflow. It doesn't shorten queues, it doesn't magically add competently trained staff, and it doesn't reduce clinical complexity. But what it does do is buy us some time. The question then is, with that time, are we able to fix the root causes? Or do we simply plaster over the gaps with this new funding? This increased work demand has been a positive impact in the community, with over 5 million consultations being undertaken in the community pharmacy sector, where the community pharmacies are now treating many minor illnesses. This is one of the more quieter but significant shifts in NHS care. Pharmacies are no longer the endpoint of the clinical pathway, where we simply provide you the medication. They are becoming the first point of clinical contact. That means the assessments are being done. There's safety net in, escalation decisions, documentation and accountability all happening in community pharmacy on your high street. This isn't an extra service, it's the redefinition of what pharmacy can do and what community pharmacy is. And as the public continues to experience this fast local access, there's no going back, which is a positive. It's great to see pharmacy stepping up in that way. Palliative care. Another headline in the news is around the palliative care pathways. There are increasing calls for national standards for how community pharmacies support end-of-life patients. Right now, the access to essential services can depend on geography, opening hours, and local service level agreements. For families in crisis, inconsistency isn't theoretical, it's distressing. Pharmacy teams in the communities want to help, but clarity, training, and stock expectations just aren't uniform. If pharmacy is going to embed itself in community palliative care, palliative support has to be designed properly, not left to goodwill. With all of these things, the workforce issue collides head on. Now let's talk about that workforce figure that is underlying all of these great projects. England alone is projected to have around 16,000 community pharmacists short by 2036. That's 10 years away now. At the same time, pharmacy is expected to be delivering more clinical care, delivering more advanced clinical care, absorbing GP workloads, expanding public health roles, and maintaining safety and those baseline services to a high standard on top of all of this. Hence, you can't scale safe and responsibly without scaling the workforce. Even with more technicians, automations, and digital tools, care is still delivered by humans. And when experienced pharmacists burn out and leave the profession, the system loses more than just a number. It loses clinical judgment and safety. So what this all means for the next 5 years. So where does this leave UK pharmacy at present? important. It shows that pharmacy can be trusted, can be relied on, and it is indispensable in healthcare. But without trust in the profession and funding and supporting it correctly, sustainability quickly turns into strain. The next phase for pharmacy isn't about proving its capabilities. As previously mentioned, that's already being proven. It's about better workforce planning that matches the reality and the expectations, funding models to reflect the increased clinical demands and risks, and a service design that protects the staff as well as the patients. Otherwise, we risk building a service that will eventually crumble. So to close off this video, I just wanted to leave you with some thought-provoking topics. As I've said, pharmacy, especially community pharmacy, is no longer on the sidelines in the NHS pathways. It's really in the middle of it. The question now isn't whether pharmacy can do more, it's whether the system can evolve fast enough to support the people doing the work. So I'd generally like to hear your view. If you work in pharmacy or know someone that does, do you feel like this is progress or just more pressure? Drop a comment, share it with your team, and subscribe if you want to hear honest and grounded conversations around the status of pharmacy and where it is projected to go. Thanks for listening. Hope this was helpful. All the best, George.